Hello, good afternoon.
Good afternoon.
How are you today?
Just fine.
Great, great. Looks like we have a few people on, so I thought I'd go ahead and open the meeting up, and that way we could say hi and see each other, but everybody's in anybody or say anything. No, okay, that's fine too.
Hello, Miss Dana. This is Stephanie Stone. I'm having some connection issues, so I apologize.
Oh, no worries. We're glad you're here. That's totally fine. As long as you can see us and hear us, then you'll be fine.
Yes,
And it sounds like
ma'am.
we can hear you. So
Happy
yeah,
New
yeah,
Year.
definitely. Yeah, thanks for being here. How's everybody else? Dr. Mean,
Doing
Lawrence?
good. How are you doing, Dana?
Good, thank you. How's the planning for the February event? That's got to be moving along, right?
Yes, it's not in February. We have two events coming up. We are still in the planning process of doing one in June. It would be more
Oh,
like
okay.
elder abuse, financial abuse. So we are still in the planning process. I would like to invite some
Yeah,
of you. I would love to have you on board in planning committee.
yeah,
Anyone
for sure.
interested, reach out to
Okay.
me. Okay.
Yeah, was it originally in February?
No, I think
Mm,
we thought of February, but I think we decided to do it in June. We don't have anything
okay,
in February.
gotcha. Okay.
Thank you.
The Texas Elder Justice Coalition Summit will be in June as well. So
Okay.
just maybe we should chat sometime, make sure well, I guess I could say it. I'm going to mention it on the meeting anyway, but tentatively June 18th in Austin is where we'll have our
Okay.
summit.
Okay.
We just
Let's.
have to pay the deposit and, do the contract thing. But
Okay.
so we're almost there. We almost have a date and the location.
Okay.
How about you?
For our, we have the location on campus. We are working on.
Mm-hmm.
We already got the location and the
Uh-huh.
logistics booked. So we just have to meet and discuss other things, participants, and all that. And if you need
Yep.
some help, or if you want me to present, I would be happy to be part of the presenters. Let me know.
Okay. Thank you.
Mm.
That sounds good.
Thank you.
How are you, Lawrence?
Quite well. Happy New Year. How are you?
Hey, yes, that's right. Happy New Year. I'm good. I feel like,
Happy New Year.
sorry, did you say something?
I just
I was,
forgot to mute it. Sorry.
oh, okay. I I feel like just 14 days in 2026, and I'm remembering to do 2026, and feel like it's just already 2026.
I still have difficulty transitioning from writing that 5 into writing a 6.
I understand. I usually do, but I don't know. For some reason this year, it's been a lot easier.
Well,
But
that's
we'll
something to be
see
said
how
for the
that
rest of the
goes.
year.
Yeah, that's right. That's right. Who knows how the rest of it'll play out? For sure. Yeah.
Well,
Thank
Happy
you
New
all
Year.
for, yeah, you too. Happy New Year. Thank you all for being here early, which is on time, right? And all those who are on time will be, wait, how's that work? If you're on time, if you're early, you're on time. If you're on time, you're late. And if you're late, you're really late, I guess. I've heard that saying before. So yeah, we'll just admit people as they come in. And hello, Shelby. How are you? Hello.
Hello,
Is it Cherry or Sherry?
Cherie.
Cherie. Okay, I didn't even guess it right.
But that's okay. I answered to Sherry also because it's
Oh,
close
okay.
enough.
All right. I like to try to make sure I say everyone's names correctly.
Can you still hear me?
Yes. Mhm.
Oh, good. It does work. I'm on like this.
It does.
Sometimes it works without the earbuds, and sometimes I have to use earbuds.
Yeah.
It's like it doesn't know what it wants to do.
Yes, I understand. It can be fickle sometimes. Hello. Happy New Year.
Thank you, Dana.
Yeah. Do you have a QR
It's already January. It's almost half gone already.
I know.
Can you believe it? Wow.
No, that's what I was just marveling at how I've been able to just transition to writing 2026. And so far I haven't had any mess ups. So I probably jinxed myself, but you know, well, we'll see how it goes. Thank you everyone for being early. It helps just kind of see who all's here when it's not everybody all at once.
Yeah.
So is that a QR code in your background there, Elva? Is that for your
It is,
ride
but I don't,
service? Yeah.
the last resort ride and wait service.
Mhm.
But when I try to click on that QR code with my camera, it's not
Mhm.
showing up for some reason. So I'm going to have to delete it and make a new QR code because it used to be in a frame on the table. And I asked
Yeah.
AI this morning to take it off the table and put it in the upper right corner of the thing.
Oh, I
And
see.
AI
So
did that, but it was a little bit, I don't know what you call it, but anyway, I needed to adjust it. And I think the QR code is not readable. If anybody
Yeah.
wants to use your phone to try to read it, let me know if it works for you. But
yeah, I'm trying it right now and it's not
reading it.
working.
Okay.
Yeah.
So I need to work on it a little more.
Good try though. That's pretty cool.
Mm-hmm.
Let's see. Here's some more meeting attendees. Hello.
Are you going to the A&E meeting tomorrow morning?
You know, I learned of another meeting, and I reached out to Justin and he said that the presenter was the same presenter at the North Texas CC. I can't remember what CC stands for, but it's the same presenter. So he kind of recommended that I go to that one instead, just to see who's there. Since it's the
Yeah.
same speaker. So yeah, I'll miss it tomorrow, but are you going to be there?
I don't know for sure. I haven't decided. I have an obligation to do in the afternoon. It's my turn to lead the book club discussion, and the author of the book that I recommended that we're reading is going to be on that call. So I've got to come up with some interesting discussion for her, some questions and yada yada. And I haven't done that yet.
Totally understand, for sure. Wonderful, wonderful. It's already 2. I know most people pop on the next couple minutes, so I will give them a bit. And I did see Zach. I did see you join, so welcome, welcome. And you said you will not have any visuals, right?
That's right. It'll just be me talking at everybody.
Okay. That's all good. Sounds great. Thank you. Good to see everybody's names and initials today. And a few happy faces.
I'll go ahead and mute my audio now, Dana, just so there's no background or anything while the presenter is talking.
Okay, sounds good. And looks like maybe 1 more minute would be good.
I'm kind of hungry. I had wanted to try the hot honey chicken tenders at Golden Chicks. So I had gone through the driveway, and as I was pulling out from the fast food window, there was a man in a wheelchair that was sitting there. So I rolled down my window and I said, "Did you like my chicken?"
Wow.
So he took my box of chicken, and I came home and I took some vegetables out of the freezer, and I guess that'll be my lunch later.
I see. Well, that was very thoughtful of you. So basically you bought somebody else lunch and went home.
Yeah, I could have gone back through, but I didn't.
Yeah. That's pretty cool. Yeah. Norma says that's very nice of you too. And Zach, how would you like questions and comments for this? Would you like people to interrupt you or raise their hand on the screen, or
Whatever people are comfortable with, I am happy to entertain.
okay, awesome. All right. Well, we are at 2:04, and I think that is plenty of time to get most people on. I will tell you a little bit about Zachary Gassoumis. I'm sorry, I can't remember if I asked you how to pronounce it.
You got it right, Gassoumis. Yeah.
Okay, Gassoumis. Okay, and Zach. Whoops. Zach is the assistant professor of public health within the Management, Policy, and Community Health Department's Community Health Practice Program at UT Health. He joined in fall of 2025 from the University of Southern California. He conducts research into various aspects of quality of life for older adults with the primary focus on elder mistreatment, caregiving, and health, social, and protective services. His research aims to improve the well-being of vulnerable populations that tend to experience mistreatment at higher rates, including minoritized groups and persons living with dementia, through improving our understanding of population characteristics, intervention, efficacy, innovative programs, and policy impacts. So he is very well versed, and he's going to share with us some of the work he's done recently. And I'll leave it at that.
Dana,
Zach,
which
just a minute.
university did you say? Which university? Is it UTD or?
No, UT Health, and he's based out of Houston.
Oh,
He's
okay.
formerly with the University of Southern California.
Okay.
Yes, it's the UT Health Science Center.
Oh,
Which
okay.
is kind of the part of the UT system, and I'm at the Houston campus.
Yeah, we have the UNT Health Science Center here in Fort Worth. Okay,
Absolutely.
thanks.
Okay, Zach, I'm going to mute everybody, and then you're going to unmute yourself.
Sounds good. I think that worked. Great, thanks, Dana. Well, thank you for that intro. It's wonderful to be here with everyone today. And I'm going to take this opportunity to do a little bit of self-serving introduction to myself and my work, and hopefully a little introduction to the type of stuff I do as a foray or a way to open the door to potential collaborations, since I'm new here in the state. And then, as Dana mentioned, I'll turn to talking a bit about one of the projects that I've done a couple years back now, and talk a little bit about this warm line project that I did in collaboration with some colleagues up in Maine and New England in general. Also, my last name is long and challenging. Please feel free to call me Zach. It just makes it much easier. So as Dana mentioned, I came from USC, the University of Southern California. I'm a gerontologist by training, specializing in research, not direct clinical practice by any means. I have done kind of a range of work related to gerontology over the course of my research career. Work in economic security, looking at demographic disparities, like Dana was mentioning, some work in health services and caregiving. But for the last 10 years, I've been pretty exclusively working in the area of elder abuse and adult protective services, with some caregiving, related caregiving work. My work in elder abuse and APS is quite broad. I tend to be kind of more of an elder abuse generalist, as opposed to focusing on just one type of abuse or one population or one setting or what have you, which is really exciting because I get to see how things work across the field. But also it can be a little bit overwhelming because we all know that that this field and this phenomenon are really challenging and look different from case to case, certainly, but across the different types of abuse, the different settings, etc., can be just so vastly disparate, vastly different. But it certainly keeps me interested and engaged. And we all know that this field is underserved, under-resourced. So it's a thrill and a pleasure to be able to work in the field and work with the amazing practitioners who are working with older adults and victims and families, etc. One of the things that actually drew me into the elder abuse field about 20 years ago or so was my brief professional history outside of academia, between my undergraduate work and my graduate work, where I worked in a bank for a couple of years. So that kind of led me to being linked up with people doing work in financial exploitation and paved the way for my current career in elder abuse and APS. So I do bring to the work a little bit of a knowledge of financial services, financial resources, etc. But I've been out of that for a long time, so there are a lot of holes in my knowledge, and I rely a lot on my practitioner colleagues to fill me in and make sure that what I'm doing actually melds with current practice. So the research projects that I do really range, as I mentioned, because I do take that kind of generalist approach. One of the big projects that I finished up recently was looking at dementia and abuse, elder abuse occurring in individuals living with dementia by talking with them and their caregivers, looking at a range of factors. Some past work has looked at injuries and victims of physical abuse, primarily as identified by APS. Also, I've done a good deal of work in interventions related to abuse and self-neglect. I led a publication a few years back on the COACH intervention, which was an elder abuse prevention intervention, really looking to provide support and resources to caregivers when they've started their caregiving journey to help prevent them from falling into abusive type behaviors, and also help them to bolster themselves as protectors of the person they're caring for, keeping them from experiencing abuse from external sources. So that kind of twofold approach. And that was a wonderfully successful prevention program. We actually saw that the people who received COACH had no abuse after the intervention, compared to about 20-25% of the people who didn't receive the intervention. So we were thrilled about that and hope to be able to continue work on it and replicate it moving forward. Within the intervention realm, I've also worked with the RISE team, primarily based up in Maine. It's kind of this up and coming, well, it's even more than up and coming at this point. It's really becoming one of the eminent interventions to supplement adult protective services, to address the issues that are being faced by people experiencing abuse and self-neglect, and really provide them with almost more of a case management supplement to the traditional APS short-term intervention and risk reduction approaches. And RISE has been found to be really effective, and it's a very rewarding program that we're now seeing replicated around the country. One of my specific efforts with that team was to add a substance use prevention or a substance use add-on to the RISE program, which we just completed pretty recently. But that was very exciting because we know that substance use can be so intricately linked to abuse and self-neglect in so many different ways. Another area that I tend to do a lot of research in is APS, Adult Protective Services Practice. For many years, I had an affiliation with the APS TARC, the Technical Assistance Resource Center, working with them on a range of topics related to their technical assistance efforts, their APS research and evaluation efforts, and also the NAMERS dataset, which is the kind of central data repository for APS data from around the country. Using APS data sources, I've also looked quite a bit at recurrence within the APS system. So in other words, what cases come back into the APS system after their case has been closed, what those the characteristics of those cases are, and using that as a way to think about how we might be able to improve the services that people receive while they're in APS to potentially help reduce recurrence. That being said, I should emphasize that recurrence, cases coming back into APS after their baseline case was closed, is not really a quality metric, not really a bad thing, or it shouldn't be used in that way, because recurrence is actually a great way of getting people linked up to the resources that are needed. So oftentimes people can experience re-victimization following the closure of an APS case, but if they don't have the resources and support around them to identify that re-victimization, they won't have a case that's re-reported back into APS. So recurrence can actually be a great way to stymie that re-victimization. And the absence of recurrence, the absence of a case coming back into APS isn't always a good thing, because it could mean that re-victimization is occurring, just not coming to the attention of the authorities. So yeah, little plug for recurrence and not using recurrence as a outcome metric there. Sorry, I'm probably talking a bit too much about these general projects. I'll try to get to the key thing I was intending to talk about pretty soon here. Within APS practice, I've also looked at how we can use information that we know about clients coming into APS and people who have experienced abuse to really improve our knowledge of elder mistreatment, elder abuse, financial exploitation, etc., because our knowledge about those populations is really quite limited. I mean, we've been working on improving that for the last 50 years plus, but it's a really challenging population to get at from a practice and a research perspective. So trying to use APS as the key agency that deals with these phenomena, linking APS records to records from external agencies like healthcare agencies, and seeing how we can use that information about known abuse from APS to extrapolate information from the other data sources. So really trying to just improve our knowledge about these victims so that we can better target supports and services and resources to helping them moving forward. As part of that, I worked with ACL, the Administration for Community Living at the federal level, on a predictive analytics project called PRAN, where we were trying to use APS data and funneling it into this machine learning system. This was kind of before the generative AI movement that we all are familiar with had taken off, but really funneling it into this machine learning and what we called at the time an AI system to try to identify people who were either maybe receiving services that didn't align with what we would expect based on their characteristics within the APS system, or potentially using the information about the APS victims to look for people within the broader population who we think might be experiencing abuse based on their characteristics, but haven't been identified yet. We could either do that at the individual level or at the community level as a way to target resources. So a lot of really interesting and exciting directions that we could take there within APS practice, and using some of these advanced technologies and statistical approaches to improve our ability to look at victims and our ability to identify potential victims in the community at large.
Wow, that's awesome. I was just thinking all the questions that I've kind of percolated over the last couple of years as I've been digging into all of this. I feel like literally all those projects are like, oh my gosh, I want to read that. That sounds like exactly what I was wondering. So
Perfect.
I guess I need to
that.
read your entire library now.
Well, in part, but also I need to do a better job of getting the papers out there. It's so easy to just go on to the next important project and not spend as much time getting the results published. So help encourage me to be better at that so that you can actually read about these things.
Awesome.
Yeah. Actually, since we paused, any questions so far? Or thoughts, comments?
Well, this is Daryl Wagner with Texas Healthy at Home. This was kind of a question I was already thinking about, and that is, what do you see are the factors that are kind of barriers or challenges between the resulting great best practices that research produces and the actual implementation of them on a broad level?
That is a great question. And gosh, I wish I had an answer for that, because then we'd be able to actually solve it. But I would say that some of the key things in my mind are really the misalignment between the approach that's taken within the academic world in trying to develop interventions that we consider to be best practices, and the desire and willingness to take these practices on in the practice world. So in academia, there's this, there tends to be this multi-year, multi-step, potentially multi-decade process to really developing, testing, evaluating, improving, refining, and accepting an intervention as a best practice prior to making a recommendation for its implementation into usual care. We don't have decades to wait in the practice world, you know? It's just not realistic. So I think one of the big challenges in my mind is that the pace of research is such that it makes it difficult to call something a best practice or to call something evidence-based in a way that could support its incorporation, its inclusion into practice. So I think on the research side, we need to do a better job of moving that forward more quickly and getting you all in the practice world information, results that will help support you to be able to take on these interventions at an earlier stage. Also, honestly, a big thing is money. At the agency level, at the political level, at the appropriations level, etc. And again, it's this misalignment, because without research that we can really turn to and say, look, this has been found to be effective, therefore we need this money, it can be really hard to advocate for additional resources, additional funds to incorporate these practices into your work. Now, there are some funding sources out there to help support innovative practices that maybe aren't a best practice yet, but are an exciting new potential direction and way of doing things. And I think taking advantage of those opportunities more often would help us bring these newer practices into place in a way that we can evaluate them, really, and kind of structuring and setting up evaluation research, researching practices as they're put into place in the field, as opposed to having this kind of artificial research-based approach over many decades before getting something into the field. So that was a bit of a long, protracted answer, but hopefully got a bit to the heart of the question there.
And Nisa has a question. Where did it go? Oh, there it is. For your recidivism research, what sources do you use to gather the information? Is it provided by APS?
Great question. Yeah, so it is typically, at least the work that I've done, has been really driven by APS data. I've worked with APS agencies around the country, and many of them, when possible, have been very generous with sharing data so that we could do some of this really innovative work, trying to get more information about the recidivism, the recurrence. I do have other colleagues who are thinking about and looking at doing some more recidivism-based research on the perpetrator side. Mine tends to look more so at the client level, which is why we tend to call it recurrence or revictimization as opposed to recidivism. But I do have colleagues who are wanting to do more interfacing with criminal justice systems, looking at criminal justice-based data, policing data, even jail data, to see about people who are reoffending, who are actually having recidivism. And of course, with APS data, I have to say it can be really challenging, because there's the tension between agencies really wanting to share their information with me and people like me as researchers to be able to build our knowledge and our information about the systems and about the victims, but at the same time being confined by, and appropriately so, regulations and restrictions intended to protect the confidentiality and the privacy of the victims, of the clients, which I very much appreciate and respect, but it can be challenging to kind of thread the needle between those two competing priorities. But we do our best. We do our best.
Gotcha.
And yeah, as Paula mentioned, RISE has been implemented in Harris County recently, which is really exciting. I've heard a rumor that it might also be implemented in West Texas as well, which would be pretty great, and at several other sites around the country. So as that gets off the ground, we'll see how it goes, and hopefully it'll give us more of that evidence to be able to promote RISE's incorporation in even more counties, more states, etc.
Yeah, for sure. And yeah, Paula said it is in West Texas also.
Excellent.
Yeah, Paula gave a presentation on that a few months ago. Very excited for Harris County. Yeah, it sounds like a really good program. I had heard about it from the people in Maine, I guess, that had started it maybe, and it was very interesting. I know we were or I was wanting to hear about the warm line, but the other question that I had was the coach intervention you mentioned. Is that recent or is that further back?
It's fairly recent. So we got it off the ground right as COVID was starting. So that kind of interfered with it a bit and changed the trajectory a little bit. So we have those results that were published, I think, about 2 years ago, and we're looking at and exploring ways to replicate Coach, to bring it into new settings, to potentially bring it into to modify it in a way that we could use it with APS clients and the perpetrators of abuse as identified by APS, or the caregivers of people who have gone through APS. Whereas the initial version of Coach was done as a partnership with a health system. So really using the health system as a way to identify people who could benefit from the Coach resources and the Coach intervention, as opposed to the people who are at the highest level of risk by virtue of already experiencing abuse, those who come through APS. So it's been a few years since the intervention was live, but we are working to revive it, if you will.
Awesome. Yeah, sounds good. Any other thoughts or questions?
I'll keep on trudging along then, but feel free to interrupt me at any point, anybody. Actually, one more thing before I jump into the warm line. I think I was a bit too ambitious with my plans for today and my time, but never mind. We'll get through what we can. One more thing that I really wanted to mention is my work with MDTs, multidisciplinary teams. That's been one of the key areas that I've done work in over the past 20 years. MDTs, by other names as well, the Forensic Center in California, we call it, and elsewhere in the country now. We have here in Harris County, SJAC, which is a type of MDT, multidisciplinary team. So my team and I have evaluated multiple MDT models, including the Forensic Center in Los Angeles, found them to be effective at improving what I tend to think of as program outcomes or system level outcomes, like referring more people to prosecution or guardianship. So found that it does really have an impact and moves the needle on the number of people who are referred on to that kind of higher level of service and care. Service, I'll say. We also did a national assessment of MDTs, which included visiting the SJAC here in Houston, which was just a really exciting opportunity. This was many years ago now, but it was just a really wonderful team. So I love to be able to see it, and I'm hoping to be able to work with them again now that I'm based here. And one of the most recent MDT projects that I did was actually a partnership with San Francisco in California, where I did more of that predictive analytics, machine learning work to use it as a way to identify APS clients who might benefit from MDT intervention. So might benefit from their case being presented to and discussed by the members of the MDT. So often clients don't necessarily gain access to the MDT. It can be challenging for the APS workers who are already so strapped for time to take the time out of their day to prepare the case for the MDT presentation, to present at the MDT, to implement any additional recommendations that the MDT members have for them. So yeah, oftentimes we see perhaps disparate presentation to the MDT based on who the worker is. And in my mind, everybody whose case comes into APS really should have the ability to get their case heard at the MDT if it is appropriate, as opposed to just as a crowd based on which worker they're assigned to. So with San Francisco, I developed an algorithm using machine learning to try to identify the cases that would be the most appropriate for MDT presentation, and have been working with them for the past few years on on a weekly basis, looking at which cases those are, whether they would be appropriate, and really trying to get more cases funneled in for presentation at the MDTs. It's been anecdotally very successful, still working on the final results for that and getting those published and out there. But yeah, that's another really promising intervention that I'm hoping, again, to be able to replicate here in Texas now that this is my home base.
Yeah, that sounds good. Yeah, actually, the proposal that I had submitted to the ACL for the
Elder Justice
innovative
Grants.
elder justice was to try to provide hub staff to support MDTs, since everybody's so busy and strapped. I was like, well, let's just insert some more people in there so that they can support the MDTs, because I know that is definitely something that I would call best practice.
Yeah, absolutely.
Shirley has a question.
Well, it's not a well, it is a question for Zach.
Comment works too.
Zach, I was just wondering, are you Greek?
I am indeed.
Yeah, I really have a strong interest in cultural backgrounds of people, so I was just a curiosity. I'm half Italian and half French, so.
I love that.
Okay,
Yep,
well, thank you.
You got me pegged. The
Thank
long
you.
complex, the long complex last name gives it away.
Thank you.
Yeah, of course. I'm on both sides. I have Greek heritage, but nobody's been born in Greece for a few generations, so a little bit removed, but still strong ties to the motherland, so to speak. I love that question.
That was totally unexpected by me.
But wonderful.
Yeah. Get to know you really well.
Yes, indeed. Yes, indeed. So I know I've probably taken us to probably pretty much the end of my time, and I haven't even mentioned the Warm Line. And yes, I've connected with Jason Burnett. Actually, his office is right past that door. So I've known him for many, many years, and he and the rest of the amazing elder abuse researchers here are a big part of why I was inspired to come down to UT Health Houston. And it's just been absolutely wonderful so far. I'll say a few words, Dana, if I can, about the Warm Line before I cede the floor. So a few years back, also right at the beginning of COVID, I partnered up with the Elder Abuse Institute of Maine, which is also where the RISE intervention originated, as well as another medical researcher based up in New England. And we were working under a fellowship from the Robert Wood Johnson Foundation, which is a really wonderful health-oriented foundation, in their interdisciplinary research leaders program, which is intended to improve people's ability to do community engaged research that is done in lockstep, in close relation to the community members, to ensure that the research is more relevant and more beneficial to the community and practitioners, etc. So we wanted to create a Warm Line, which would be a resource for people within the state of Maine to call in about potential abuse that they're seeing, to get additional information, resources, guidance, etc. We really wanted to target this to home care workers, the home care workforce, which encompasses people providing home health services, kind of more formal nursing help, occupational therapy, physical therapy, etc., but also people providing more of the day-to-day ADL support, so personal care services and personal support services. This is a population that is considered to be mandated reporters, certainly in Maine and throughout most of the country, certainly here in Texas, where we have universal mandated reporting for elder abuse, where each and every one of us on this call and beyond is a mandated reporter. But yes, the personal care workers, the home care workers in Maine, they didn't always know a whole lot about elder abuse or their reporting obligations or how to identify it, et cetera, et cetera. That was especially true, and not just in Maine, really around the country, for the home care workers, especially the personal support staff, who were employed directly by individuals as opposed to as part of a large organization, a large agency, etc. Those individuals just don't have the infrastructure to provide them with elder abuse training, with support, with guidance, with an expert really to bounce off the situations that they're facing. Also, these individuals are really in a challenging position. They are uniquely able to gain access to information and to the dynamics of what's happening within a home. And they see things that nobody else in the health and social service delivery system would have access to. But at the same time, they're most commonly employed directly by the people who they're working for, and their employment is contingent on a good relationship with these individuals. Therefore, if they're seeing abuse happen, they're faced with this choice. Do they report it to APS? Do they try to address it? Do they bring in external agencies and likely tip off the people they're working for that they're the ones who reported because they're the only ones who are probably seeing this happen, and then jeopardize their employment, jeopardize their livelihood? Or do they just kind of keep on going through things and looking out for themselves while also at the same time doing what they can to improve the situation of the individual through their work with them within the home? So home care workers are in this really challenging, impossible in many ways situation where they have this legal mandate to report, but doing so would jeopardize their relationship with the individual, potentially jeopardize their employment, and frankly, potentially result in this person not having, let's say they fired the individual, potentially resulting in this person not having the support in their home, becoming more isolated, more at risk, etc. So it can be really, really challenging situation for these individuals to be in when they're facing this question of whether to report to APS. So we all know that APS has hotlines where you can call in to report a situation of abuse. We wanted to put into place a warm line, something that wasn't quite as hot as the hotline, but a place where the home care workers could call in to get advice, support, etc., about the situations they were seeing, what they were dealing with in the home, and use this as a way to get support, to get guidance, to get a professional's perspective on things, and also to work through that question of whether they should be reporting what they're seeing, if there are other things that they could be doing to support the individual, and yeah, just a kind ear to talk to about these situations that they're in. It was challenging to put this into place because it happened, this project started right at the beginning of COVID. So there were a lot of implementation challenges and barriers, but we got it in place. The numbers are, I'll say, not quite as high as we were hoping that they would be, excuse me, but through this project, we were able to develop a really robust workflow, a robust set of educational materials, etc., for the people who were staffing the warm line, so that they could really help these people who are facing these immensely challenging situations. And let's see, I just saw a question from Amanda. How is the warm line different from an anonymous call with the same conversation? So people can call in anonymously to this warm line. I think that the goal of it really was to provide more of an information and support line with people who, with workers, with warm line staffers who really knew a bit more about the situation that the callers might be in, that being providing personal support services, and could provide more dedicated or more directed advice, more tailored advice to their situation, and also could talk through the situation with them a bit more than, say, the APS hotline people would be able to. Maybe troubleshooting a bit more, providing some alternative approaches, and frankly, fully knowing and understanding that even though the caller might be a mandated reporter, that they may not always be able or willing to make that report. So providing alternatives there. So yes, the caller could call in anonymously, absolutely. it's helpful to have their information so that there could be some follow-up after the fact, but the warm line would take all callers. Elva, I see your hand up.
It is up, and I was wondering, some of us belong to an abuse, neglect, and exploitation group, a working group that's hosted by the Office of the Texas Attorney General. So it's called the ANE group, Abuse, Neglect, and Exploitation. And a couple of months ago, we had the Houston Fire Marshal as our speaker, along with a guy that worked with him. And it was really interesting to hear their perspective because they have access to these small group homes. You know, they see things that nobody else sees, and they do report. And I think that is a key reporting source that I had never thought about, the fire marshal's office.
Yeah, absolutely. That is a really important one. And actually, another faculty member who was here at UT Health Houston until recently, he's now at Texas Christian University. He created many years ago what's called a DETECT program, which is intended as a support and a resource for emergency medical services personnel, paramedics, etc., to have kind of a guide for recognizing abuse, recognizing self-neglect, and knowing when it might be appropriate to report that to APS, to the authorities, because these people, similar to the personal care support workers that I've been talking about, go into the home and gain access to see things that are that no one else can see, that no one else has access to. So it's a really important population for us to support as a broader professional community.
Yeah, the fire marshals created a little business card size way to report that they give out to ambulance drivers and other people to just put under their visor to know how to report abuse when they see it, which I thought was a great idea. Yeah, and Dana has created these small business card notices for the same purpose. Thank you, Dana.
Of course.
So great.
And it sounds like you were talking about Dr. Brad Cannell.
Exactly.
Yeah.
Yep.
Yeah. He's shared with us previously as well. And I think he has a class right now. That's why he's not on. And did you see Amanda had a follow-up question?
Yeah, it's a great question about the liability of callers if they call but decide not to report. So it's something that we did wrestle with a bit, and we chose to address that question by first and foremost purging the records of the warm line at a pretty regular basis, such that there would not be, frankly, a paper trail. There would not be a record of people calling in, of the issues they were discussing, etc., that could jeopardize the warm line callers. I, as a researcher, took some of that information, but I had a federal certificate of confidentiality, it's called, basically protecting that information from disclosure even under subpoena. So yes, well, theoretically, if the warm line records had been maintained and there was a name and a full description of the discussion and the recommendations made, potentially it could open up liability for the callers, but we were really mindful of that and took steps to minimize that liability at all costs.
Wow. Nice. Well, thank you for sharing all that with us.
Yeah, sorry, I talked for way longer than intended. Thank you all for indulging me. I appreciate it.
I feel like that is super important. So I'm glad that there were questions and people were definitely interested, and I can zip through the rest of it pretty quickly, or save it for another time. So one last call. Any other questions?
Well,
all right,
everybody. Appreciate it.
Oh, for sure. Thank you, Zach. Can't wait to dig into all that research and information. So quickly, the charters for the coalition and the committees have been completed. And then Shirley, I don't know if you would like to talk about this, but I thought I would share this on the call. Shirley Trapani, the person who likes to know
If you're Greek,
backgrounds.
Greek or not. I'm sorry.
Shared
I mean,
with
if you
me
can't tell, if you can't use the humor in your job, then, you know, my goodness. Okay,
All
you can
right.
tell I'm Italian. Okay. Yes, ma'am. Thank you, Dana. Are you going to share that? You said in a moment.
I am.
Okay.
I'm going to share the picture of the flyer. Did
Oh
you
yeah,
have
that
the
I thought you
other
were talking.
information?
Oh, I thought you were going to talk about the other updated flyer that you did, the one pager.
No, I
Oh.
wasn't going to talk about that one at all. I was going to bring this up because I thought
Oh,
it might be useful for
yeah.
people across the state. And I can read your email, but I just thought since you were the one that sent it to me, maybe
Yeah,
you'd like to share.
so yes, I'm on a pretty large distribution list that has like probably, I don't know, maybe several thousand people on it. And it derives from the University of Texas. It's just a kind of a social work. I don't want to say it's just social workers, it's professionals that call out to the people on the distribution list about various resources for one thing or another. And this came through a few days, a couple of different times, actually, initially alerting us. So what it is, Dana, I don't know if you have the email open for this, but it's someone posing. So they put up these flyers in what area was that? Houston, Dana?
Yeah, in Kensington.
Oh, excuse me.
And
I'm sorry, in California, I guess it was. Yeah. So they posted, and this came from a lady who works at Texas Harm Reduction, one of the respondents on the distribution list. And so they're putting up these flyers in California, and I guess you can close the email now so people could see the flyer. And
there we
they're
go.
they're posing, they're putting up this scam, and they're calling them rehab specialists, and they're identifying them, calling them body brokers, and with these false hopes that they call this number, they're going to take them into this rehab facility, which is what this poster is, with a contact number. And you can see what the lady wrote, and there's an article about it, a little bit more details, but they're scamming people right and left and getting kickbacks on substance abuse. So you can see it was alarming when I saw that, and I wanted to share it, so I sent it to Dana. So there you go. Body brokers.
Yeah.
Body brokers. I mean, how horrifying.
Body brokers, benefits trafficking. Yeah, it all kind of, is unpleasant. One of the things that I noted from the email was if somebody happens to mention rehab in California, that they're likely being recruited by body brokers. So that was the other thing. And I noticed that the flyer looks really exciting and great, but I guess it either does not look like this or it doesn't exist at all. I'm not sure, but anyway,
Yeah, but
that was
thank you, Dana. I appreciate you bringing
sure.
that up very much. Thank you.
Of course, yeah. Well, the last 2 months we had a case study, so this one's kind of in the discussion case study realm. Any other thoughts or comments? I see Elva has her hand up.
Dana, I'm reading a 2025 copyrighted book called Rehab: An American Scandal by Shoshana Walter. I have it out from the Arlington Library,
Oh, wow.
And I've just started reading it, but I'm really interested to hear what it has to say, but it goes along with what Shirley was saying, I guess.
Right. Yeah. It's a little bit unnerving, all these different scams and issues going on. It almost seems like we all really have to work together, that's for sure. I'm gonna really skim through the rest of the agenda because you can read it as well as I can. I'm excited about the Elder Justice Program presentation coming up, and that is in March. We're nailing down our February speaker. I've also created a webinar series, which I'm going to share in the newsletter, and you can register for that in the newsletter. And then we have a tentative date for the summit, June 18th in Austin at the Public Library Special Event Center. And it's tentative because the contract and the deposit and all that's not done yet, but that's what we're looking at. And collaboration committee is working on warning flyers. I think our intern that was going to help with that was on. I'm not sure if she's still there, but we'll have more on that. The Money Smart program is now recorded and available on a YouTube video in English and Spanish. Our speaker bureau request form is now available. We have resources sustainability meeting coming up, and then a couple of work groups that I've asked or mentioned to some of you guys over the last I don't know, month or so, but we received a grant from WellMed to create a 3-hour education of nurses, community health workers, kind of like a turnkey a training. And we'll meet Friday, January 23rd at 1. And email me if you'd like to be added to that. There's a data project that also wanted to talk about Friday, January 30th at 1. And then policy. I did see Ann and Andrea on, but I don't know if they're still on, but definitely would like them to participate in the policy one because we have less than a year now until the Texas legislature starts up again. So if you would like to join a committee or work group or would like to know more, let me know. Send me an email. Our social media still adding slowly but surely. The federal legislation that's going on related to financial exploitation, I have also listed in the newsletter, so be on the lookout for that. And FTC has a new tool, and it's how I'll avoid a scam, my action plan, and it's a document to encourage discussion and note businesses and phone numbers and what to do in the event that somebody calls and you don't know who it is. So it tells you know the signs. They contact you and say there's a problem. They tell you to hurry, or they tell you how to pay. And this reminds people to pause and talk with someone they trust. And then it has contact and business information. So everything will be on one place if that happens. Okay, see, look at that. We just zipped right through there. Any questions? Did I talk too fast? Elva Cherie wants to know about information. How do I make this bigger? I just see the pop-up. Information on the body
snatching. I don't know about body snatching. Yeah.
Body brokering.
Yeah.
It looks like
I don't know if she's asking about the book or Cherie, what?
Or maybe a link to that news article from the Kensington story.
Yes, I will send that in it's going to be in the newsletter as well, which everybody should get tomorrow. There's the book, author and title, info about, about the, are you talking about the body brokering, and the flyer that we were just talking about, Cherie? Okay, so there's there's a link to an article, and it's going to be in the newsletter, so you should get it tomorrow. Yeah, no, I don't want to try to look for it now, but I can just email it to you, one off and it'll be in the newsletter. So, yes. Okay, any other questions? Did any of that make sense? I did see quite a few new names up here, so welcome. We're so glad you're here, and also welcome. So glad that our long timers are also here. So look for the newsletter. There's going to be lots in it, and hopefully I'll see you all soon. Thank you for being here.
Thank
and
you,
I'll
Dana.
stick around. Yeah,
Thank
of
you.
course.
Take
You're
care.
welcome. You too.
care. Bye, Zach.
See you, man. Bye.
Okay,
Thanks, everybody.
bye. I see. There's Cherie. Oh, thank you. And Norma. And looks like a couple of note takers and Dara and Stephanie are still on. They may or may not be on. What happened to your headphones?
Oh, I took them off. It was working without them so good. Yeah, I
Wow.
clicked to close. I downloaded the image of the book. And so when I clicked it off, it's like my whole thing went away. I clicked the wrong X.
Oh, I
So,
see.
yeah.
Okay. Because I was trying to figure out if we had given you the right information, and I didn't know you weren't there.
Yeah. And that was the right information. So once I get that, I'll give it to our caseworker because we deal with cases. And so I'll tell her, this is something new that we haven't had yet. So be on the lookout.
No,
So, yeah.
awesome. Yeah, for sure. Okay, cool. All right. Take care. Thank you.
Thank you. Bye-bye.
Bye.